Hey everyone, we are really excited to be here with Nick Fotache with RevUp Dental. We are really excited to welcome them into the Dentist Advisors Partner Program. And we're excited to be welcoming them because of the resources that they bring, and especially in an evolving industry inside of dentistry, especially when it has everybody talking about AI and how to increase patience in your practice, utilizing SEO. We're frightened about all the above, who to trust and who to use to do so. We're excited to work with RevUp, and I'm going to allow Nick to make a good introduction to the business as we continue to provide content from them.
Well, thanks so much, Spencer. So it's great to be here and partner up with you guys. Basically, RevUp Dental helps dentists increase their revenue. We help them get more patients, increase their production. And, the way we do that is in three pillars. So first, we have marketing. People can't do business with you unless they know you exist. So, if they're going online, they're searching for a dentist and you're on page 10 of Google, you're going to be the best dental practice that most people have never heard about, right? So we solve that. We help build, nice websites. We increase your SEO. We help you rank better on Google. We run your Google ads, social media, help, create social proof. So helping dentists get more reviews. I mean, if you're, buying something on Amazon, let's say like a pair of headphones, one of them has 25 reviews, 3.9 out of 5. One of them has 500 reviews, 4.9, out of 5. Which one are you probably going to buy, right? So most patients, they're not, they don't have any clinical skills. They don't know which dentist is better. They're going to look at what other people are saying. So we're really good at helping create patient testimonial videos, getting more reviews, and sort of positioning your practice as these guys seem like they're the best choice, right? Now from there, we are really huge on data and tracking. So one of the things that we've always hated with, marketing companies is you'll get a report every month saying you got 500 website clicks and you've got 25 Facebook likes. And it just sounds like you're reporting on how much monopoly money they made you, right? Because if you're paying that invoice every month, $1,000, $2,000, $3,000, whatever it is, you can buy things with that, right? You can go and deposit that in a bank. But when you're getting a report saying you got 500 clicks, can you pay your staff with clicks? Right? Can you pay that invoice for that marketing company with impressions, right? Like it doesn't have all that much value. So we've always put a lot of emphasis on trying to figure out, how much does this actually improve your bottom line? So we will track things like who called, who are they, what were they looking for, how did they find you, and do we know for sure that they came from marketing, or maybe they were a referral who was going to come in regardless, even if you didn't do any sort of marketing. Who spoke with them? Was our staff nice? Were they helpful? Did that patient, end up booking the appointment? Did they show up? And if they didn't, right, if they didn't book the appointment, what happened? What can we learn from that? What can we do better next time, right? So we're really big on trying to show dentists, this is how much money you invested. It's been 3 months, 6 months, 12 months. This is how much your revenue has grown. And here's all the data to back up that growth actually came from, our work. Now, make no mistake, it is teamwork, right? So it's not like we come in and we sprinkle some magic SEO dust and then, the practice starts doing a lot better. It takes teamwork, right? So a big part of what we do is because our software collects tens of thousands of new patient calls every month, and we analyze how our different practices are handling them. We use this data and we use AI to figure out what are the top practices doing. So when the patient calls in and he says, how much do you guys charge for Invisalign? How are the practices that are doing, $2, $3, $4 million of revenue? How are they answering that question versus how are the average practice answering that question? Like what actually works, right? So we also help the team try to understand this is what you have to do today to grow your practice, not, kind of what traditional consulting will teach you, which is this is what used to work in the 70s and the 80s and the 90s. And the fallacy is that if you run your practice that way, it's going to help you in 2025. So we're always trying to look at what are the most successful offices around the country doing today? How are they treating those patients? How are they talking to them? How are they rebooking them? And we gather a lot of data about, what's the average missed call rate? What is it at your practice? What is it on, practices in the same state or the same province? How many patients call to cancel an appointment? What percentage of those patients does your staff rebook for an appointment? What percentage of them even ask the patient if they want to rebook? So this is where sometimes you discover a lot about a practice where, the dentist assumes, if somebody calls to cancel, for sure we'll ask them and we'll try to book them for another time. And then we play recording after recording where that's not what happens at all. In fact, the staff say, well, okay, no, you can't come in Wednesday, not a problem. I've canceled it. Call us back when you want to come back, right? And sometimes dentists get this huge shock where they start to see what's really going on in their office. So I think if you really want to increase your practice revenue, there's a couple of things you need to do, right? So first of all, you need to get people to know who you are. We're not flipping through yellow pages anymore. You're not going to your mailbox and pulling out a flyer and picking that practice. Sure, some people do for sure, but most people, they're probably going to go online. They're probably going to look at reviews. So we need to do marketing in a way that appeals to the modern consumer, not the consumer from the 80s and the 90s and whatnot. We need to track all that data and make sure that it's actually working. We're not just like measuring fluff and unicorn dust, clicks, impressions, things like that don't mean anything. I think dentists, what they want to see is new patients, production, booking rates, things like that that are a little bit more tangible. And ultimately, we need to work with the team. When you got to empower the team to give them tools to make their job easier, a lot of these receptionists, they're juggling a million things every day. The phone's ringing. There's patients you're checking out. New patients are coming in. They're struggling, and nobody's there to kind of like support them by giving them the software and the training to, essentially perform at their best. So that's kind of like a quick, in a nutshell. Obviously, I can dive into a lot more details. But yeah, by bringing all those three things together, marketing, data, and team training, if you glue them all well, practices see tremendous growth. And the average client we work with, their revenue grows between 40 to 60% in 12 months. And we get this data because we pull the numbers out of their QuickBooks, their patient management system, and we can back up those numbers.
That's incredible, Nick. What a good insight into a great business. And we're so excited to be working with you. For everybody checking this out, you're looking at dentistadvisors.com, or you've been referred to here, and more to come from RevUp and Nick's team. Really excited to have them on board. And Nick, thanks so much for your time.
Thank you, Spencer.